Hi, and welcome to Talking About Cancer and Oncology Social Worker's Perspective. This is a Survivor Journeys 101 presentation. I am Roxy Locke, and the other presenter today is my colleague and friend Lauren Souls.
Hi.
We're oncology social workers here in Western Massachusetts, and we couldn't begin this presentation without sharing that we are so grateful for the support and resources offered by Survivor Journeys. Their peer mentoring program and support groups have become valuable and trusted sources of assistance for so many of our patients. We are very happy to be here speaking with you today about a topic that we hope will be helpful for our viewers. We're going to start today by telling you about our role as oncology social workers and why we believe talking about how to talk about cancer is so important. We'll start by offering some guidance around communicating with those closest to you, such as family and friends. We'll talk about communicating with kids and talking about cancer at work. We'll also discuss some recommendations for communicating with your care team and how this can benefit both you and your medical providers. Lauren and I are the two social workers at the MGH Cancer Center at Cooley Dickinson Hospital. We both started here about 3 years ago, after 10 years or so in other healthcare settings. We are constantly humbled by and honored to be working with individuals and families affected by a cancer diagnosis. Our role here is twofold. We offer emotional support to patients and families, sometimes directly, sometimes by connecting people with other support resources in the community, such as Survivor Journeys. The other side of what we do is more concrete. We offer financial and logistical resource assistance to help patients and families navigate living with cancer. We spend a lot of time in our roles speaking with patients about how to talk about their cancer diagnoses to various people in their lives. Our goal today is to share with you our observations and experiences in guiding patients through talking about cancer. We believe, based on our experience and feedback from patients and families, that good communication contributes to greater overall well-being when facing life with cancer. We want to be clear that we are not communication experts, that all feedback is welcome, and that any views and opinions expressed here are our own. We also recognize that much of this presentation is subjective and not a one-size-fits-all set of guidelines. We respect your personal choices around how to communicate about your diagnosis. Part 1, talking to the people that mean the most. When talking with family, partners, and close friends, it can be helpful to set explicit boundaries. We can think of this as getting comfortable saying no. This is hard for many of us, but it's important to put yourself first sometimes. You can tell certain people that you wouldn't like calls or texts, for example, the day after chemotherapy or in the mornings before 10 a.m. If it makes you feel more comfortable to provide an explanation, then keep it simple and clear. I don't feel great the day after chemo, or I haven't been sleeping well, so I'm generally not up for chatting until mid-morning. Thanks for your understanding. On the other hand, clearly stating needs and expectations and saying yes can make a big difference in how easily you can navigate some of the care challenges of undergoing cancer treatment. We found, based on countless conversations with both patients and families and friends, that assigning tasks can be mutually beneficial. Most people want to help and don't know how, so ask for something you need or want. This will be helpful for you and make your loved one feel good too. For those people in our lives who want to be needed and helpful, you might as well suggest something that would make your life a bit easier, rather than trying to be polite by saying no or by saying, sure, anything you feel like doing for me would be lovely. If you do this, you might end up with more casseroles than you can fit in your freezer or other things you don't need. My mom had cancer when I was young, and I can still hear my dad saying, we'll never eat all these lasagnas. It might make accepting the help a bit easier if you tell yourself that you might return the favor at some point. Sometimes accepting help now means you'll need less help later. Think about it this way. If you conserve your energy on a Monday by letting your friend cook for you or do your laundry, you might find yourself rested enough to do it yourself the next few days. If you don't know what you need, say so. Maybe you could figure it out together. Saying yes to help when offered, even if you don't know what it is exactly that you need, is easier than asking for it later. You can say, yes, but can you check back in next week? I'm all set for this week, but I might need a ride to treatment next week, depending on how I'm feeling. Or you could tell people that you could use some help, but you've asked that your friend or sibling be contacted for assistance in figuring out what you might need that day. Identifying a point person to call in as needed for giving updates, asking for help, and more can take the job of coordinating your care off your shoulders. One way to do this is using an app like CaringBridge, which we'll talk about more on a later slide. In addition to practical benefits of communication, there are also emotional benefits. Being open about fears, worries, and joys can have a positive impact on our coping. Everyone functions differently in terms of disclosure and openness, which is important to keep in mind here. Some of us may have a fear of talking about cancer because we end up taking care of the person we're talking to. This could inhibit us from sharing in the first place. We might think, for example, my neighbor won't know what to say if I tell them I have cancer. It will make them uncomfortable, and I'll end up having to reassure them that I'll be okay, even if I'm not sure I will be. Preparing yourself for that possibility is helpful. You can be ready to say something like, thanks for your concern. I don't expect everyone to know what to say. It's just helpful for you to know in case I need some help with snow shoveling this winter. Cancer is the elephant in the room in so many conversations. You can go ahead and point that out to try to diffuse the situation. Say that you know it can be hard to talk about. If you do know what you want someone to say when you share news about your cancer with them, tell them. You can say, I just want you to tell me you love me, and you're there to talk when I need to. Or, you don't have to say anything, just give me a hug or hold my hand. Talking about our feelings can allow us to feel less isolated, foster the feeling of being a team. While you have the right to tell only those you're comfortable with about having cancer, we found that sharing this yourself allows you to control your narrative. Before someone can speculate about why your appearance is changing, for example, you can tell them yourself. Your neighbor doesn't need to know why you're losing weight or hair, but it can feel protective for some of us to inform people and make sure they know however much we're comfortable sharing. I want to take a moment here to point out that all of this is easier said than done. Clear communication in any relationship can be challenging in the best of times, and when under stress of a cancer diagnosis, it can feel impossible. Side effects from treatment like fatigue, pain, and maybe even mood changes caused by medication can make talking about all of this even harder. Ironically, these are the times it's even more important to be honest if you can. Several patients we've worked with have shared with us that steroids taken during chemo cause irritability, often leading to increased tension at home. In the instances where these patients shared with their loved ones why they were experiencing mood changes, the family was more empathic and understanding, mindful of the fact that in many ways, the patient's irritability was beyond their control. None of these suggestions will always work perfectly, if at all. It's okay to ask for professional help from your social worker, a therapist, or a support group. Sometimes this is exactly what's needed. We've found that most of the time, it's easier to worry together. A lot of the time, you and the people you care about are all scared of the same things. Consider sharing what you're feeling and giving your loved ones the opportunity to help hold you up. I'm going to speak now a bit about talking with children. I want to start by noting that there is an excellent Survivor Journeys 101 presentation focusing just on this one important topic, which is worth viewing if this kind of guidance could be helpful to you. For the sake of time, I will touch on some of the broad strokes of how to talk with kids about cancer. For additional information, the PACT program, which stands for Parenting at a Challenging Time, is a wonderful, comprehensive resource for parents and caregivers living with cancer. We'll provide that website at the end of today's presentation. As a rule, with children, inclusion is more protective than exclusion. Including kids in your experience helps minimize kids filling in the gaps with their own ideas about what's going on. Counterintuitively, the more we include children in a hard, upsetting experience, the less fear and magical thinking will occur. Children can process more than we realize and are more perceptive than we think. We're not protecting our children by lying to them or telling them that everything will be fine when it's not. By talking about the harder stuff, you're helping them develop resiliency and encouraging them to feel safe in speaking up, asking questions, and trusting people throughout their lives. Your kids might not respond the way you expect them to, and it doesn't mean they don't care about you. It's normal for younger kids to react with questions that affect them first and foremost, such as, "Can I still go to soccer?" or "How am I going to get to school?" It helps to address their immediate concerns first, answer their initial questions, reassure them of how their routine will stay the same or how it may change. Remember, it's okay not to have the words or all the answers, and to be honest about that too. Challenge yourself to a redo conversation if you need to. Try elaborating or changing the language. By doing this, you're telling your kids it's okay to not always get it right the first time. Similarly, by showing your emotions, you're showing your kids that it's normal and okay to cry or to be upset. We encourage our patients to keep this in mind when preparing to talk with children about a cancer diagnosis. There really is so much to say about talking with children about serious illness, and we hope that you'll view the PACT website and the Survivor Journeys presentation. The PACT website is listed on a later slide. Before turning it over to Lauren, I want to elaborate a bit on the apps that can be used to communicate with family and friends. These can also be helpful in making sure your kids' needs are being met when a parent is going through cancer treatment. Some of the apps we found most helpful are Caring Bridge and Lots of Helping Hands. These can relieve some of the pressures of keeping your loved ones informed of changes in health status. They can help you from feeling like you need to repeat yourself, spend time reaching out to different people, and to keep your care in one place. It might be useful to identify a point person to manage the site, update it as needed, being clear about what you need and when you need it if you can. Most of these apps make doing so easy, with a calendar and sign-up feature for meal delivery, rides, and whatever else you may need. Lauren is going to speak with you now about a different kind of communication, that of talking with your employer.
Thanks, Roxy. I'm Lauren, and we're going to move on to part 2, talking with your professional network. As a patient or family member, you might have all kinds of feelings when you think about communicating with your employer about a new or ongoing illness. You may be worried that telling your boss or coworkers will change their view of you or affect your job responsibilities. Just like talking to your loved ones, your decision to disclose or share information at work about your illness or a family member's illness is a personal one. If you do need to take a medical leave or request a reasonable accommodation, you will be required to disclose enough information to demonstrate that you have a serious illness. Remember, as an employee with a serious illness, there are laws to protect you and afford you certain rights. Where do you start? Before you head right over to Human Resources, consider talking directly with your healthcare team. Your provider can help you understand your treatment schedule and possible side effects, and weigh in on working through treatment or if you need to consider taking time off. In your appointment, consider telling your provider about the kind of work you do and asking, "How do you think this will affect my ability to work?" Although your provider may not be able to give you specifics, they can often share generalizations about the time commitment of your treatment schedule, how well your treatment is typically tolerated, and if any of your medications might affect your ability to think or drive. If you or your family member is dealing with cancer, you should consider reaching out to Human Resources or the office manager next to inquire about your benefits and leave options. Most employees have access to some type of job-protected medical leave, FMLA, ADA, or in Massachusetts, the new Paid Family and Medical Leave, or PFML. HR can help you figure out what type of medical leave you are eligible for and if you have any options for receiving pay while you are out of work. You might be thinking, why can't I just use my paid time off? and you certainly can. The huge benefit of using a medical leave, however, is job protection, meaning you cannot be fired for missing time related to a serious illness. If you are nervous about asking HR about your specific situation, you may want to simply start by inquiring about where you can find information about your benefits and time off. You could also try asking general or hypothetical questions. You could ask, if my family member gets sick this year, what kind of time off or leave can I use if I miss work to take care of them? Cancer and Careers and Triage Cancer are two wonderful nonprofit organizations that offer extensive educational information about medical leave and how to have these conversations. Once you know what leave options you're entitled to, and you have a sense of what your treatment and schedule will be like, you can formulate a plan about when to take medical leave or how to work through treatment or around medical appointments. You might find it necessary to start talking to your supervisor and coworkers at this point in order to strategize about how you can manage your work responsibilities and who at work might be willing and available to take on some of your tasks or help in some way. If you are a manager or have a team working for you, this will probably be an especially important conversation to have. You could consider gathering a small group or talking to employees one by one. You could start by saying, "Hi team, I have some information to share with you." By initiating the conversation with your team at work, you can set the stage for how you want your coworkers to interact with you, what they can expect of you while you're in your treatment, and how they can help. Roxy's earlier suggestions around talking to family and friends might also be useful in guiding your conversations with your coworkers. For some people, sharing their story at work is a huge relief and connects them more closely with the people they spend all day with. Setting boundaries, stating your needs and expectations clearly, and your willingness to accept offers of help will probably be just as important at work as it is at home. Not so different from sharing with your loved ones, disclosure at work about your illness can be an ongoing conversation that evolves throughout your cancer experience and serves as another layer of your support network. What if you don't want to tell people at work about your illness? Remember, your medical leave arrangements are between you and your HR representative and should always be in writing. Your supervisor will be notified by HR that you are taking a medical leave and your plans around missing work. The Family Medical Leave Act and the Americans with Disabilities Act offer specific protection from discrimination and retaliation at work related to your documented medical leave due to a serious illness and your related absences. Importantly, the job protection piece of these laws is what allows you to miss work unexpectedly or repeatedly without violating an absentee policy or risking your losing your job. Remember again, you are not required to disclose any additional medical information beyond what is required by FMLA or ADA to certify that your illness is serious. You and your healthcare provider or social worker can work together to figure out what language to use and how much to disclose on your medical leave forms. If you've been away from work for several weeks or months, it can be a huge adjustment to go back. Continued communication with HR and your supervisor is essential as you make plans for getting back to work. Talking to your healthcare team and social worker about your plans to go back to work can be helpful too. You could ask your doctor, "When do you think I'll feel more like myself?" Or, "I work a very physical job. When do you think it will be safe for me to go back to work?" Under FMLA and the Massachusetts PFML, you are entitled to return to your same or equivalent role. Many patients work with their employer to coordinate a gradual return to their normal schedule or develop a hybrid model of work. An ADA reasonable accommodation request can also be used to start a conversation with your employer and formalize your return to work plan. The goal of any accommodation request should be to help facilitate the employee to engage in and complete their normal work responsibilities. For example, you could request to start back to work at 2 days a week and increase every 3 weeks until you return to full-time. The nonprofit Ask Jan offers a wealth of information that may be useful as you consider making a request. Even if you are not planning on missing any work, having these conversations and putting them in writing can give you the peace of mind knowing that you have the flexibility and job protection to prioritize your health and take time off for medical appointments or rest when you need to. Moving on to part 3, talking with your care team. As far as I know, all healthcare organizations have some sort of formal written list of patient rights and responsibilities. At Cooley Dickinson Hospital, where Roxy and I work, the patient rights document states that it is the patient's responsibility to be an active, involved, and informed member of your healthcare team. Despite this, patients often tell Roxy and me how nervous or uncomfortable they feel being the one to bring up a question or concern with their doctor. Even though it might be hard for you to speak up, it is so important that you find your voice and do your best to articulate your questions, concerns, expectations, and goals of care. Remember, your medical provider's job is to help you understand your medical condition and treatment options so that you can make a fully informed decision. Your provider should take the time to explain your diagnosis and options clearly, giving you the opportunity to ask questions and make choices that are in line with your treatment goals. But there is no way for your doctor to answer your questions or explore your concerns, or for that matter, help you address your symptoms if you do not speak up. At your next appointment, you could try saying something like, "I have some questions I wanted to talk to you about today," or, "Before we get started, I wrote down some concerns I want to go over." Maybe you are the person, like me, who forgets the questions you thought of late at night or before your morning coffee by the time you arrive at the clinic. Try to take the time to jot down your questions when you think of them. Or if you have access to a patient gateway, consider sending a message to your provider the day before with a list of your questions. You could say, "Hi, Dr. Jones. I'm sending you a few questions that I want to talk to you about during our appointment on Friday." It might be helpful for you to bring someone to your appointment or have them on speakerphone to take notes and be a second set of ears to hear what the provider has to say. You may find that you are better able to focus during your appointment and process new information or steps, knowing that you and your visitor can talk it over later. You can also try logging into the patient gateway after your appointment and reviewing your provider's notes to make sure that you understood the plan and next steps. Patients have told me that they worry their questions take up too much time or it's a bother to the doctor. It isn't. Your questions are an important way for the team to get to know you. By reporting how you are feeling, coping, and managing your responsibilities, you are also ensuring that your medical chart is accurate. Just as you are entitled to have your questions and concerns addressed, you are also entitled to a second opinion. Asking for a second opinion might feel uncomfortable or seem awkward, and you might be worrying that you will offend your provider. You won't. As the patient, it is your job to ask questions and try to make sure you have enough information to make a good decision. You can ask your oncologist, "When would be a good time to see a specialist in Boston?" Or you could say, "I'd like to have a second opinion about my treatment options. Is there a specialist or hospital you recommend?" If you are thinking about clinical trials but don't know how to bring it up, you could try asking your provider, "How do clinical trials work for my kind of cancer?" Or, "Are there any clinical trials we should look into?" Whether you are wondering about how to get a second opinion or if there's a clinical trial for you, remember, if you don't ask, your provider won't know that this is something you're interested in pursuing. You are also entitled to request a change in your provider or transfer your care to another cancer center. If you think another provider might be a better fit for you, you could talk to the social worker or call the scheduling team at your cancer center. You could say, I'm currently working with Dr. Jones, but I would like to make a switch to Dr. White. You don't have to give a big explanation or disclose the exact reason that you want to switch providers. Your medical team knows that the most important thing in your cancer care is that you trust your providers, feel heard when you ask questions or voice concerns, and feel respected in your decisions around treatment options and goals of care, even if that means that you choose to seek care elsewhere. In summary, what you say matters to your loved ones, to your employer, and to your cancer care team. Take the time to think about what you want to say and the words that feel comfortable. Remember, you are human. It's normal to make mistakes, feel your emotions, and change your mind. None of this is easy. However, talking about it might help you feel more in control of your experience during an otherwise overwhelming time. All cancer centers have an oncology social worker who can help you navigate these pieces and more. On this slide, you'll find the resources we mentioned throughout our presentation. Please let us know if you have any questions about them. Roxy and I want to thank you so much for taking the time to listen today. Our emails are included here. Please don't hesitate to reach out with any feedback or questions about our presentation. Thank you again to Survivor Journeys for all that you do and for the opportunity to speak on this topic today.